Hello, my name is Diego Hernandez, and I'm with the Beyond the Spectrum campaign here at Da Vinci Design High School. Today's lesson will go over the basics of sex ed itself, and it's a way for you to learn the different fundamentals of sexual intercourse, along with the different types of birth control and the practice of safe sex. The first thing, in order to gain basic understanding of sex, we will go over the function of the genitalia, such as the penis and the vagina, and there are three different parts of the penis: the root, the shaft, and the glands. The root starts and is attached to the abdomen, and then the shaft is actually the middle part of the penis, and the glands is actually the head, which is covered by a layer of skin called the foreskin. Usually, the foreskin, however, is removed using a surgery called circumcision. The body of the penis is made up of a circular shaped chamber, and there's multiple of them, and they're all sponge like tissue. And when the penis is actually erect, or when a man is fully aroused, those chambers actually fill up with blood. This allows the penis to become erect and allows for penetration during sexual intercourse. Within the testicles, there are reproductive cells called semen or sperm, which comes from the urethra. This semen is actually produced by seminiferous tubules. When the penis is erect, however, the urine is blocked and unable to flow from the urethra, and it's only letting semen flow through. The urethra is actually a thin fibromuscular tube that allows urine to flow from the bladder to the outside of the body. And in addition to the testicles, there's an almost pouch like sac of skin just below the penis. It controls and balances the temperatures of the testicles, and for they have to be somewhat cooler than the regular body temperature. Then there's the vagina itself, which includes both external and internal structures. The main external organs for a vagina are the labia majora, and it's the large lips which protect and enclose the other external organs. The second one is the labia minora, and it is referred to as the small lips, which are directly underneath the labia majora and are made to protect the vaginal opening and the urethra. And then, however, there's the third part, which is the clitoris, and it's a sensitive protrusion that is sometimes compared to a male penis. It is covered by a small layer of skin, and that's called the prepuce, and which is referred to as similar to the foreskin as well. And then the last one is the Bartholin glands, and those are located near the vaginal opening that produces fluid secretions. And then on the flip side of things, there's actually the main internal structures of the vagina, and the first one is the vagina itself. And it's actually a flexible tube linking the cervix of the uterus, and it connects to the vulva and then to the exterior of the body. Then there's actually the uterus itself, which is also referred to as the womb, and it has two parts that consist of the cervix and the corpus. The cervix lets sperm enter and menstrual blood to exit, and then afterwards there's the corpus, and it's there to expand when a baby is developing and giving is birthed. In addition to the uterus itself, there's the ovaries, and the ovaries are a small oval shaped organ located on either side of the uterus. They are meant to produce eggs and hormones as well. And lastly, there's the fallopian tubes, which are meant to guide the egg cells from the ovaries all the way to the uterus. And then the fertilization process usually occurs in the fallopian tubes as well. The vagina is actually also able to stretch several inches wider during intercourse and during childbirth. The vagina is as well a self-cleaning oven, meaning it is covered with glands that create fluids and that both lubricate and self-cleanse the area. During intercourse, the elasticity of the vagina is able to accommodate whatever size the penis is. After ejaculation, the fastest sperm meets the egg and forms a single cell. Then the pregnancy begins when a fertilized egg attaches to a woman's uterus and begins to actually grow. There are other forms of sex as well that don't actually involve full on penetration or the vaginal penetration, and those are called oral and anal sex. Oral sex is the sexual activity of stimulating another person's genitalia with your mouth. Actually, for some individuals, oral sex is much more pleasurable than sexual intercourse itself or actual penetration. However, if you are feeling pain during intercourse, it is important to discuss that with your doctor. Anal sex is the action of inserting the erect penis into a person's anus for sexual pleasure. It is important to have a discussion with your partner before having any sort of sex because it's important to know if they're interested in participating in anal sex. With all the different forms of sex, it's essential to practice it safely. There are many different types of birth control, and the most common birth control is condoms. There are male and female condoms actually. Also, even though that most condoms are made out of mainly latex, those who are allergic to latex can actually purchase other condoms that are made out of other materials as well. And there are actually a variety of different birth control methods, but the most popular one, also besides condoms, is birth control pills. And when using birth control, it's important to research the type that you will be prescribed to in case they affect people differently. And birth control pills are 99% effective. Even though birth control pills prevent pregnancy, it does not prevent any STDs from transmitting from one person to another. It is meant to be taken once a day and at the same time every single day. Another form of birth control that someone could use is a vaginal ring. It's usually a flexible plastic ring that produces estrogen and progesterone. And also, it's the ring that is placed in the vagina for 3 weeks and it's taken out for the 1 week during menstruation. Women, however, also have a different option, and that's called the diaphragm. And it's usually another tool meant to fight off pregnancy. And it's usually dome shaped and made of rubber. And it is meant to stop sperm from finding its way to the egg. It is essentially a shield that covers the cervix and must be used with spermicide. Also, there's the IUD, which is another form of birth control, and it is surgically inserted and is used to avert sperm from entering and reaching the egg. And this method is usually 99% effective as well and can last actually about up to 10 years. There's also the patch, which is a less complicated method of birth control, and it's placed on the stomach and then the arms and the lower back as well. And usually it lasts for about a week. Last but not least, we have the implant. And it's similar to the IUD, but it is about the size of a match and it's embedded to underneath your skin and on your upper arm, and they're usually 100% effective as well. Even though these methods of birth control lower the chances of pregnancy, all of them, except for condoms, don't actually prevent STDs. And here are the most common examples of STDs that you could get or transmit to somebody else. The first one we have is chlamydia, and it's an infection that is the most common transmitted disease. It as well shows little to no symptoms, making 75% of women and 50% of men unaware that they're actually carrying the disease. However, after 3 weeks of noticeable symptoms begin to occur, such as abnormal discharge within women, painful periods, itching or burning around or in the vagina, and within men, they actually may be there may be a small or large amount of discharge that comes from the tip of the penis, and there's usually painful urination and pain or swelling around the testicles. Fear not, though. Actually, chlamydia is easily curable with antibiotics. And then we also have HIV. HIV stands for Human Immunodeficiency Virus, and this virus attacks the immune system, and when left untreated, can gradually become AIDS after 10 to 15 years. Catching this disease, however, does not always happen due to intercourse, but may occur after the use of an infected needle or syringe or from mother to child birth. A huge percentage of the world unfortunately suffers from HIV, and sadly, there's no direct cure for HIV or AIDS, but there's a form of medicine that can definitely be used to control the virus so that the individual can live longer and a happier life as well. Up next, we have gonorrhea, and this STD can actually be caused by oral, vaginal, or anal sex. Gonorrhea and chlamydia are the ones that have usually similar symptoms, such as the burning sensation during urination, painful or swollen testicles, or increased vaginal discharge, so they may be difficult to differentiate. Either way, it's important to discuss with your doctor to eliminate the disease before it gets out of hand. Also, another STD that we are going to discuss is hepatitis, and this virus may not actually show any sort of symptoms at all at first, but it may be diagnosed with the flu, or they might share similar symptoms. And some of these symptoms include loss of appetite, fatigue, or even mild fever. And there are three different types of hepatitis: hepatitis A, hepatitis B, and hepatitis C. And it's usually caused by the consumption of fecal matter, and that's hepatitis A. And that's also contracted using sexual contact with another individual. B is actually caused by direct contact with infectious blood or birth from an infected mother. So a child can get hepatitis B as well by just being birthed from a mother with hepatitis B. Hepatitis C, however, is usually contracted by contact with blood from an infected person or the use of an infected or unsterilized needle. And another STD that we actually have is HPV. This virus is most common among people who are sexually active, and the symptoms that show are depending upon the type of HPV that a person has. One of the most common symptoms that someone with HPV might contract is genital warts, and those are raised, flat, or pink colored. And this is there's no cure for HPV, however, but it may clear up eventually on its own. But nowadays, due to many males and females getting vaccinations, the number of those diagnosed are coming down to a minimum. If you or someone that you know might have an STD, it's very important to contact your doctor as soon as possible to get a better understanding of the disease that you've contracted, or even put a stop to the disease or control it somehow. And you should never feel scared about having the disease. It may be a scary topic or something that you don't want to share with a lot of people, but you need to be more open about it in order to fight off the disease, because then you can find some people that are actually supportive of you and will be willing to take you to the doctor to be somewhat of a support system as well. Regardless of age, it's always important to know about the basics of sex and using a condom properly, using birth control properly, and to avoid STDs in general, because you really do not want those at all. And that's all I have for you today. I hope you enjoyed our video, and stay tuned for next week. Thank you.